Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient, Stacy Finnerty. So Stacy's been in our thyroid program for about 3 months, and why don't you just, talk about, where you were before you came in, the sleep stuff, your back stuff, whatever you want to talk about.
Well,
there's a lot,
there's a
so.
lot. Where I was when I came in was in pain every day from a back injury. I had broken my back in a car accident, and I had also just recently come from another accident where I had a concussion and severe damage to my brain was shaken up just from an incident. And I couldn't see straight, I couldn't think straight, I couldn't sleep. My vision was off, my equilibrium was off, everything was off, and I'd been on morphine for probably 5 years, and then 5 years before that I was on Loratab or a fentanyl patch. I've been on pain medication for over 10 years, if not 11 years, and I'm not on it.
And that was a result of the car accident where you had fractured your spine, and they put surgery in there, rods and screws. And so when you came in to see us, you've had that ongoing, and then you had this new injury, where you hit your head. But the real reason that you came in was because of thyroid, the lack of sleep, and all that.
Well, I didn't know.
Right, because you came in.
That's just it. I came in with a banged up head.
Right, came with a banged up head.
I didn't know I
and
had
the
a
chronic
thyroid problem.
Right, and the chronic, all this stuff.
I had
so
a lot of pain in my stomach.
Yeah.
An extraordinary amount of pain in my stomach. I couldn't figure out what it was. Everything was hurting me. And then I took tests from you, and we found out it wasn't just my head and knocking myself around. It was that.
Yeah.
As well as issues with thyroid. I also found out I was pre-diabetic, which is a huge deal since diabetes runs in my family, and also found out I had parasites in my stomach that I needed to get rid of. And that all made sense because I was looking at colon problems and colon diseases, and I did not know because my primary doctor had told me nothing.
And you've had
I had
all
5.
the tests. Yeah.
I probably had 3 MRIs, 3 CAT scans. I had a couple ultrasounds. Went to the hospital, emergency, because I was in so much pain, and they still couldn't find it out, and they still were sending me to have more MRIs, and I just said no.
Yeah.
I'm not doing it anymore, because I was starting to come here.
Yeah. Well, and plus they were going to do MRIs the same area, and they didn't find anything.
The same thing, and just spend more money.
So you initially came in because of that head injury, and you've had chronic back pain. And so when you came in, we started looking at this, and I said, I think this is all a big, mess, and it's related, and you got all these different things, and we need to sit back, we need to go do a full workup on you and do all the testing and stuff like that. So when we did that, and all the tests that came up were tests that you had never heard of, most doctors never heard of, but we found out the problem was you.
Right. So
we found all that stuff, and we have worked on you neurologically and metabolically. We have not touched your back where the surgery was and all that stuff, and
which I have to say I appreciate. I've gone to several doctors before, chiropractors and other doctors, and I've had a chiropractor before. My surgery is my L5S1, my lower back, and I've had doctors try to snap me in my lower back, even though they realized I had rods and screws in my spine.
Right.
And then after they had done it, said, "Oh, I forgot." And not only that, I've had doctors yank my neck or yank something to make sure that it pops, and I know I'd always feel a little off. And what you've done is barely move just my neck and just my back, but it not even enough to where I would even pop, because I was so tight and strained and swollen and inflamed the first 2 or 3 months that my neck wouldn't even really pop. It just now, after, actually it's been 5 months that I've been coming in, and it just popped for the first time last week.
Yeah.
And I
So
appreciate that you didn't pull it until my neck was ready.
Yeah, and when we adjusted, we were nice and gentle and got that to it. But the lower back, because when we did all the exam and I remember we talked about 3 causes of inflammation: orthopedic, neurological, and metabolic. Well, the orthopedic was from the surgery, and they did the surgery, and actually if you look back now, the surgery was a success.
Yes,
the
it
problem
was.
is that you had neurological and you had metabolic. So we didn't even
Right.
touch your low back, and all of her low back pain is gone. She's off morphine that she was on for 5 years, and Lortab and the patch before that, so 11 years. So that part of it, and that's all because of the thyroid and all the testing we did on that. And we've been doing that program where we found you had parasites, we worked on that, and we were getting everything, you know, taken care of. And in the process of doing this, you're sleeping. Just tell them about your sleep and
Oh, I couldn't sleep at all. I've been up every night, all night till about 4 or 5 o'clock in the morning. Typically that is my week. Every single week I would not sleep. And I have been sleeping so much better than ever. Every now and then I'll have a night that's off, just
Yeah,
because
well, I mean,
for other reasons.
Yeah, but also, you know, I mean, you've had this for 11 years, you know,
Yeah,
so
yeah.
it's kind of unrealistic to think in
Right.
2 months it's going to be fixed. So
Right.
we're on the way, but you still have
Right.
it could be stress, it could be, you know, whatever.
Right.
But I mean, overall, compare where you were, you know, before to where
Right.
you are now.
Well,
I mean, what
I
else
was
is
a mess. I was a mess. I couldn't see straight. I couldn't turn my neck in my car. Now I can turn my neck. When I was driving, I was unsafe because I'd have to turn my whole body. I can sleep. My stomach doesn't hurt as badly. No, it doesn't hurt. It doesn't even hurt at all. And
But are you still having some stomach stuff? Because I mean, it's going to take a
No.
while to get, okay, good.
well,
Yeah.
and the thing is, I have to mention too, is that I went on the anti-inflammatory diet, which helped tremendously. And of course, as you do, you have moments of weakness and you cheat because it's really hard. It's a very, very difficult diet. And I realized when I was not on the diet that I was feeling lousy. I felt a lot, I had more headaches, I didn't feel well, I felt sluggish. And obviously diet's huge. However, for this process, that you have to do the anti-inflammatory diet to find out, you know, through those tests what is wrong.
Right.
But it's also helped me learn how to eat better in general to help yourself feel better.
Yeah. Well, and the thing is that, you know, we do the tests, and they're specific tests, and they're going to be different for her as there are other people that come in. So from that, we find out what the triggers are. We remove those, and that's what's, you know, quit poisoning your system. Now we're working, and what we've been doing the last 4 or 5 months is working on the damage that caused. So anyway, you're doing a lot better, and what we want to do is check in with you in about 3 months to see how we're doing there.
Okay.
And you know, the improvement. But
I'm not cross-eyed.
Yeah.
I can see straight. I'm not nauseated every day.
What about headaches? How we doing
I
with
don't
those?
have headaches.
Okay, all right.
This is not the me that came in when I first
No.
started.
And I'm sure, you know, well, number one, your husband's probably, we saved
My
more
husband's
marriages.
very happy.
but I mean, you have, I mean, a lot of friends and stuff
Oh,
that
yes.
have known you over the years.
Oh, yes.
And I know some of them were nurses, and we're probably
Yes.
going, Stacy, I don't think this is going to help.
Oh, yeah, a lot of people. Of
but-
course, because, you know, it's...
Right. Well, and they mean well, you know,
Well,
but
right,
they didn't
right,
know
right.
about this stuff. But I know that they said that to you, and you know, the thing about it is, this is not for everyone. You have to be, and I told you when you came, you have to be a candidate. You know,
Right.
you have to have all the markers, parameters. If we got a good chance out. So I'm glad you're doing better, and we're gonna check in with you in about 3
Thanks,
months. Okay.
doctor.
All right. Thank you.